Hi, we're here today with Dr. Justin Grannell. He is a family doctor with Beacon Medical Group working out of Bristol. Dr. Grannell, thanks so much for joining us today.
Thanks for having me.
So we are talking telehealth today. COVID-19 really changed the way healthcare was working overnight, and providers, consumers really embraced telehealth when in-person visits halted. What can you tell us about this milestone that we recently reached?
Well, we have now reached 10,000 telehealth visits, which is quite amazing. Over 300 Beacon Medical Group providers have been trained, hundreds of medical assistants, nurses in a very short period of time due to this coronavirus outbreak. And the team under Cindy Hayes has done a phenomenal job. It's a lot of time, a lot of effort, and you have, in addition to that, physicians like myself who like to ask a lot of questions and call, and I bugged them quite a bit, and they were always very receptive and very helpful. So they did a fantastic job getting a lot done in a very short period of time.
But we're in a different place now. So these 10,000 visits under our belt, where are we today?
Okay, so for 3 or 4 weeks now, we've started to see patients again in our office. So we are open for business. We are, if you're scared to come into the office, we're doing appropriate screening, temperature screenings. We are socially distancing in our waiting room, and we're keeping respiratory illnesses out of our office, either sending them to urgent care or seeing them via telehealth and getting people tested for coronavirus at any number of our drive-through sites. But that has brought our number of telehealth visits down, but we are still seeing people who may be scared to come into the office with certain medical comorbidities who are at higher risk for complications. And we are allowed to do that with insurance companies right now, which has been nice that they have allowed us to do that. And so that has supplemented our ability to see the patients in our office now.
Yeah, back when we were doing, and again, hit the 10,000 milestone, what sort of visits were you seeing a lot of at that time when, again, people couldn't come into the office?
Basically everything. We were seeing sick visits. We were seeing routine chronic illness follow-ups. We eventually got to the point where we were able to see not only new patients but Medicare wellnesses, which are big, and trying to keep people up to date with those when you're shut down for well over a month in the office. It was nice to have that as an option.
So, no one has a crystal ball, but as we're moving forward, it's safe to say that telehealth is really in a new place, and it's going to be more important to consumers, to healthcare providers moving forward. What are your thoughts on that? Again, knowing you don't have a crystal ball.
Yeah, definitely. I think telehealth has changed the way that we practice medicine, and I think it is here to stay in some extent. Certainly, I think there are some chronic visits that we just really shouldn't be doing on telehealth over time. We need to listen to the heart and then do a more thorough exam that we just can't do with telehealth. But certainly, counseling visits in the future for myself, it is going to be provider dependent on what they feel comfortable doing with telehealth. Um, ADHD follow-ups, counseling on any number of abnormal lab results that may come back as a result of a physical and blood work. Things like that certainly help to supplement and help reduce the number of times that the patients have to drive to the office, which can become overwhelming for those patients who have multiple medical issues.
But how would you describe or how would you characterize the times when people really do need to come in and physically, face to face, see a doctor?
Based on the complaint, certainly if they're having certain symptoms, our triage nurses do a great job triaging that often themselves and make the determination based on our office protocols on what can be put on the telehealth visit and what can be brought into the office. So we rely very heavily on our phone nurses to make those decisions for us.
Yeah, so people should they call ahead at this point if they need to schedule an appointment to see you?
Yes, certainly they should call. In the future, there's going to be digital technology that allows them to schedule their own appointments, and that will be something that is coming at some point. But yes,
Thank you so much. 10,000 visits. Appreciate all that you have done in jumping on board as a family doctor.
thanks for having me.